Okay, this is ALHS 1090, Chapter 12, the Female Reproductive System. This reproductive system, this is the female reproductive system. So this is an overview of the anatomy. Here's some of the functions of the female reproductive system. We will be touching on some of these things in parts of our medical terminology. Basically, you have menstruation, where the uterine lining sheds, ovulation, fertilization, a few terms with pregnancy and childbirth. The main hormonal players here are estrogen and progesterone. Gestation is one of your vocabulary words, and that is the length of pregnancy. So from fertilization to full fetal development, that is 9 months, or actually 40 weeks, which kind of technically is 10 months. In addition to the lower abdominal organs, the mammary glands play a vital role in that they produce milk. So lactation is one of your terms, and that refers to the production and release of milk from the mammary glands. Okay, all right, getting into our term list. Ovario and oophorio both mean ovary. So an oopheroma would be a tumor of the ovary, and ovariorexis would be rupture of the ovary. Vaginal and colpo mean vagina. Now, 9 out of 10 times, if we are using colpo, it has to do with colposcope, the instrument, or colposcopy, the process of examining. But most of the time it will be vaginal. 3 word roots meaning the same thing, all 3 meaning uterus. You have utero, metrio, hystero, all mean uterus. So endometriosis literally means abnormal condition of the inside of the uterus. Hysterectomy means removal of the uterus. Salpingo, that's coming up funny on this. Salpingo, we had this term in the special senses chapter with the ears. Salpingo means tube in general. In this case, it's talking about the fallopian tube. So salpingoplasty would be a surgical repair. Salpingography would be written record or process of recording the uterine tubes or the fallopian tubes. Salpingitis would be inflammation of the tubes. Cervico, we also saw cervico when we did the musculoskeletal system, and that we were referring to the cervical spine. In this case, we're referring to the neck of the uterus. The cervix is the neck of the uterus. So cervicitis, inflammation of that cervix. Cervicography is is a repair of the cervix. Amnio means amnion. Amniocentesis literally means the surgical puncture of the amnion. Lacto, I just mentioned this when we're talking about lactation with the mammary glands. Lacto means milk, so a lactogen means something that produces milk. Gyneco means woman or female. So a gynecologist is a specialist in the study of women. Gynecology is the study of women. Gynecopathy, sorry, slipping over that word, is the disease of the women. Mammo and masto both mean breast. So mammogram is a written record of the breast. Mammography is the process of recording the breast. Mastitis is inflammation of the breast. And mastectomy is the surgical removal or excision of a breast. Meno refers to menses or menstruation or period. Sorry, this is coming up a little funny on WebEx, the PowerPoint. It got a little maladjusted here, but menorrhagia is hemorrhage or heavy flow of menstruation. And amenorrhea would be discharge of no menses, so without period. Metro, also metrio, means uterus or specifically to measure. So metrotosis means downward displacement of the uterus. Nato means birth. So prenatal, before birth, postnatal is after birth. Antenatal is the times immediately surrounding a birth. Laparo. Now, laparo does not necessarily have to belong to the female reproductive system. Laparo means abdomen. So if you had surgery laparoscopically with a laparoscope, that's an instrument used to visualize the abdomen. Laparoscopy is the process of visually examining the abdomen. And laparotomy are the holes, the incision to make for the laparoscope. So this could be a laparoscopic appendectomy, could be hysterectomy, could be a gallbladder. So not necessarily female related, but it's attached to this chapter. Okay, our suffixes. Arche. So arche means beginning. So menarche is talking about the beginning of menses. Gravida means pregnant woman. So multigravida would be a pregnant woman with multiples. So twins, triplets, quadruplets. Primigravida is the first. So it's a pregnant woman with her first child. Para means to bear offspring. So multipara means someone has multiple offspring, not necessarily at the same time, but as with gravida, but multiple offspring. Primipara means the first offspring. Nullipara means they don't have any offspring. So salpinx is the suffix form of salpingo, which was referring to the fallopian tube. Hemosalpinx would be blood in the tube. Hydrosalpinx would be fluid that doesn't belong there in the tube. Pyosalpinx is pus in the tube. Totia. Totia is childbirth or labor. So dystocia would be difficult childbirth or labor. Eutocia would be kind of good or normal labor. Version means turning. So if something is retroverted, it's turned backwards. Okay, some abbreviations. C-section stands for cesarean section. The folklore about this was Julius Caesar was delivered via C-section, and that's where they get the name from. Forward, okay. DOB is date of birth, DOB. DNC is dilation and curettage. So the cervix is dilated, speculum is inserted into the vagina, the cervix would be dilated, and then curettage is a scraping tool. So usually for the purpose of placental fragments left in the uterus following childbirth that was not expelled, or endometriosis, other reasons. This is a surgical procedure. LMP is last menstrual period. GYN is a shortened term for gynecology. WNL, within normal limits. YR is referring to year. PAP. I have no idea how to say this. No one's ever said this. So in my career, Papanicolo, I'm assuming that's someone's last name, but a pap test is a pap smear usually. And I'm going to go back to the photo of the DNC. What a pap smear is, we're not going to ask you to write out or spell or fill in the blank with Papanicolo. But what a pap smear is the speculum is inserted, and it's a Q-tip-like device. A few cells are scraped off the cervix. Should not be painful, and tested. It's a test for cervical cancer. It's a lab test, pap smear. Okay, stat means immediately. STDs, sexually transmitted disease, and STI is sexually transmitted infections. Okay, and then we come to practice slides. So you can go through and you can kind of quiz yourself on these practice slides. And that's the female reproductive system.